Hi, everyone. We're very excited to be here today. This is Kathy Schaaf and
Fernando Quintero
from Berkeley Media Studies Group, and we have people just joining us, so we're going to go over some of the logistics and then dive right in. So today our webinar is on elements of newsworthiness and developing relationships with journalists. And for those of you who are new to BMSG, a little bit more about us is that we are a nonprofit. This is our 25th year, and we do three main things. We research news coverage on public health issues, and a lot of our research is online, how things are framed, what the messages are, who's speaking, and also recommendations based on that research for both public health folks and journalists. We also do media advocacy training and strategic consultation for community groups and public health organizations. And this is some of the work that we've already done with the San Joaquin Valley Public Health Consortium is really in this training area. And then the third thing we do is professional education for journalists. And that is something that we also work with them to help them understand what questions they can be asking about public health and health equity. So, and we'll repeat this information as more people come on, but we wanted to let you know as we go through the webinar, if you're experiencing any technical difficulties, you can call WebEx. Their number's right here. It's 1-866-229-3239. And on the right-hand side, you are hopefully seeing a chat box under the participants. And you can always just put a message to Heather, and she is our great staff member who's behind the scenes today doing a lot of the work to make this webinar run smoothly. So again, she's going to be putting lots of information over in the side box, and you can look for any information there and directly chat with her. And we want this to be interactive. We want to hear from you. We're going to be asking you some questions, and we want you to ask questions throughout. So to send us a message, you'll see on the right-hand side, again in the chat, you can just type away, ask us questions. But what's really important is that you send it to all participants, and this is just part of WebEx. If you choose all attendees, it'll only go to the people watching the webinar. We as the presenters won't be able to see it. So again, just make sure if you have a question, there's a drop-down box and select all participants, and that way we'll be able to see any of the questions you ask. And so this information, some of it's in the side box too if you need to remember it, and we'll be available, monitoring that throughout. So today's presentation came after we did a one-day, half-day training in person with quite a few people from the San Joaquin Valley Public Health Consortium. We have a grant from the California Endowment to work with health departments across the state of California to build capacity related to racial justice and health equity communication. And so we did the first training in person, and then this is one of the areas that we didn't have enough time during the day, so this is following up on that. And we're really going to focus on just a quick review of the importance of having a media strategy, the importance of a media strategy being part of your overall strategy. And then we're going to review the key elements of newsworthiness. So how do we present our information in a way that's exciting, that will capture the attention of journalists and will get in the news? And we'll learn proactive and reactive strategies to gain media attention, and we'll gain insights for building relationships with journalists. For those that I haven't met personally, my background is much more working in local health departments. I was at Alameda County Public Health Department in Oakland for almost 12 years, but we're very fortunate today to have Fernando here, and I'll let him talk a little bit about his background in journalism.
So I'll provide some of the lessons that I've learned and some of the insights that I've gained as a journalist and editor for mainstream print publications for over 25 years throughout California and really throughout the country. So I'll bring some of, again, those lessons learned and insights to you all today.
So you're getting tips from someone who's been on the other side from public health, the one actually reporting on the news. So we're really happy to have Fernando here today. And I just wanted to mention, since this builds on the in-person training, we don't want to review everything that we did in there because we want to, go on to new information. But each health department had some staff members who were able to attend. So we really encourage you, if you're new to the Berkeley Media Studies group and weren't at the in-person training, to connect with the folks who were able to attend in person and talk about these things. We really emphasize practice. Our tools aren't necessarily complicated, but they require lots of practice. Being able to communicate effectively on the spot is really about practicing. So it's a good opportunity for the people who attended to share the information in practice, and a good opportunity to build more capacity with more people in the health department. The three main areas we covered are the layers of strategy, which we'll go over quickly in a minute. We talked about message development and the main components of a message, and we talked about framing. And you can see that Heather is putting some resources in the chat box. So if you weren't at the in-person training, these are great tools. A lot of them are worksheets that help you work through your issues. And then there's the resource, What Surrounds Us Shapes Us. It's a very short 4-page document that covers a lot of the things that we covered in the in-person training. And it's also just a great tool to kick off a discussion about this at a staff meeting or within interested groups of folks in the health department to talk about how you might integrate some of this. So with that, we are going to turn it over to Fernando and talk about the news.
So to get us thinking a little bit about elements of newsworthy, I'd like everyone to think about the following question, and then please type your response in the chat box. And remember again to send it to all participants. So the question that we're starting off with is just think of a recent news story from either this morning or yesterday's headlines, and just type in why you think that story made the news. So we'll give you a few minutes just to think of a quick story and why you think that made the news. Just type in something brief.
So we have car fire affected many people. Going very fast. A story about racial disparities in breastfeeding. It was tied to Breastfeeding Week, World Breastfeeding Week. That we'll definitely talk about things like that. A teenager shot. Very sorry to hear that. Guns. California fires, we know that's huge in the news. And also just want to say we know that many of you are working on that and appreciate you taking time out to be with us today. And we hope some of the things here may be helpful for thinking about how to develop relationships with the reporters who are reporting on the fires so that you can talk about related issues that come out of the fires, whether it's housing or extreme weather events. Let's see, others are loss of life and property is why it was newsworthy. I'm assuming that's about the fire. A news story made people angry. Big effect, it affects so many people.
Drowning.
Let's see, maternal infant mortality, heat and air quality, drownings, guns. So, and you can keep writing them in. It's great to hear what is on your radar.
So we'll give folks just 15 more seconds to see if anybody has any other thing they want to contribute. Immigration, we just saw popped up. So this is great. This is, again, this is just to get us thinking about stories that appear in the news and why they make it to the news. And that's really the focus of our presentation today, which are elements of newsworthiness. So we'll tie back some of the lessons that we're learning about elements of newsworthiness to some of the questions and some of the stories that you all highlighted. But before we get into the elements of newsworthy, it's important to remember, and this is something that we stress in all of our trainings and webinars, is that message is never first. So if we're thinking about a message, whether it's a message that you want to have a story propel forward, whether it's a blog, whether it's providing testimony at a council meeting, whatever it is and the purpose of your message, we need to remember and keep in mind that that message has to be part of our larger communications plan. So I'm going to review that communications plan, which Kathy alluded to already, which is our layers of strategy. You should all have a copy of that document, and if not, we'll make sure that you all get it. But basically, it outlines the 4 layers of strategy that we need to keep in mind. I just noticed the link that Heather typed in the box, in the chat box, so you all can access it there. But just a reminder that as you see, our media and message strategies come after our overall strategy. So it's looking at what our overall strategy is that will determine if we even need to access the media or engage with the media. We may find in our overall strategy in answering some of those questions that there may be other ways to reach our target and gain support for the change that we want to see in our communities, be it a direct meeting or some other way of making that connection. So overall strategy, just as a reminder, is first of all identifying the problem or issue that we want to address. Remember that we cannot be strategic and comprehensive at the same time. We need to be very focused, narrowly focused on a particular issue or problem. And then, of course, once we've identified that problem or issue, we also want to identify what our solution is going to be, whether it's in the form of a big P or small p policy or some other way of addressing the problem. We need to identify who has the power to make the change. We must know who our allies are that are being mobilized to apply necessary pressure to the decision makers. And then, of course, we need to think about what our message will be, what do the targets need to hear.
And so we just wanted to mention, because the focus of our work through this grant is on communicating about health equity, and oftentimes what we see is if people get down to the message strategy and they have a hard time making it about health equity, it's because they actually need to go back to the overall strategy and really make sure they're using an equity framework around the thinking critically about the problem and developing the solution. And we know that, it's tricky in health departments to think about how we really change the structures. As you can see in this diagram, it's changing the structures, not just treating the outcomes. And that itself, going through the overall strategy, can take a long time, a lot of meetings, a lot of partnerships, a lot of work. It's iterative. We might have to keep going back and refining it. And so when we're first speaking about health equity, we may not have a very clear policy solution, but we can start to at least plant the seeds of it. So whether we're talking about immigration or the built environment or access to transportation or housing and the aftermath of the fires and how that's going to affect housing, that might be sort of a broad area, like Fernando said, that we're sort of not ready to have a strategic policy yet, but our goal really is to narrow in what do we want to change and who has the power to change it, and to really think about that from an equity perspective. And we know that there's local health departments work in different constraints, and so sometimes when we are getting really strategic, it might be partners, faith-based community, youth, other folks that are mobilized in the community who really bring the issue up in the media, and then create an opportunity for the health department to provide data or speak about it. But it really requires those partnerships. So we just want to acknowledge that even though we're quickly moving over the overall strategy, that is a big chunk of work, and we really respect all the time that health departments have to put into even getting to that part before we move on to the communication.
So we're going to now review elements of newsworthiness. Keep in mind that this is not an exhaustive list of elements of newsworthiness. These are some key elements, but there are others to add to the list. But again, today we're going to go over some of these key elements. I'll review them all now, and they are injustice, seasonal link, research/breakthrough, broad interest, local news angle, irony, conflict/controversy, anniversary/action date, and celebrity. So Kathy was just talking about the importance of keeping your health equity goals in mind, and we're going to start with a health equity issue to highlight the element of injustice. Health equity issues such as health disparities and social determinants of health are inherently have elements or include the element of injustice. That's just inherent in issues around, as I said, health disparities and social determinants of health. So as you can see from the one example that we included on this slide, here's a story from San Jose Inside publication, which highlights a study in San Jose, Santa Clara County, that identified health disparities and actually led to funding for African-American focused clinic. So that's one example of how you can use issues around health equity and health disparities as a way to gain media attention. So the next element is seasonal link. So think about holidays, think about times of the year like back to school, other sort of notable events that are seasonal that we can tie a news pitch or news story to. So here we have a great example from Kern County, which started out as the Kern County Public Health Department's own internal sugar shock challenge. So this was an internal sort of event or program that asked employees of the health department to track their daily sugar intake and then take steps to reduce their sugar intake. So what they did was they took this outside of the department and then encouraged people in the county to watch their sugar intake. And then the seasonal link that they used was obviously Valentine's Day, because that's a time of the year when we think about, you know, chocolates and other sweets. So there was a good example of someone using a seasonal link. Research and breakthroughs are another way to gain media attention. Oftentimes people think, you know, well, does it have to be, you know, a journal-published, peer-reviewed research study, you know, that's ready to go and has gone through all the checks and balances. And the news media really relies on trends to often tell stories. And these trends can be just that. They can be observances that a department or an organization has seen over time and can, you know, qualify or quantify either, the numbers or somehow be able to talk about a trend. So, again, just to emphasize that sometimes just a simple report can gain media attention. Here in this example, we have advocates in Queens, New York, who used their own research to point out food swamps, which, as we all know, are neighborhoods or areas, usually in low-income communities, usually in communities of color, that are saturated with unhealthy food outlets, fast food places, and the like. And having come from the Central Valley, I'm quite familiar with these types of neighborhoods and how many communities in the Central Valley deal with this type of issue.
And then I can just add another example from the health department. When I was at the Alameda County Public Health Department, for us in the Bay Area, housing is a critical social determinant that really impacts health. And we had some legislation coming up that was a ballot initiative, and so we were constrained about speaking directly on the ballot initiative, but we did want to raise the profile of housing being a health issue, public health issue. And we also, wanted to be able to keep putting out resources around this that we could continue to use in different ways. So we did a survey of our own public health staff and behavioral health care to see how the housing crisis was affecting their clients, affecting their ability to serve clients, and affecting our own staff. And we chose to start there because we didn't quite have the capacity to do a large resident survey, but we did have the capacity to survey our own staff. With that, we got high enough numbers, and then we did some basic qualitative coding and had some quantitative closed-ended questions. So the biggest cost was just staff time on that, and put together a 4-page report. We wanted the qualitative data so we'd have stories, and then we wanted the quantitative data as well. And so, it was very profound and very, very tough stories to read. And then we were able to work with community partners and other think tanks to do a press release. They were able to get a conference room at the Oakland City Council, so it was a very official place. A lot of press were there. It got coverage, headlines about the housing crisis. And in those news stories, a lot of times there'll be quotes of landlords or the real estate agencies and things like that. But because we had controlled this whole event, the only message in there and the only people quoted were really public health folks. So all of the stories were really focused on health and housing. And so it was in the whole sea of things, news out there on housing, it was a few stories that really contained our message and framing and the way that we wanted it. And then we were able to reuse those news stories over and over as we sent them out to different folks as a concise way of saying, this is why we care about housing.
Great. And just to keep in mind, as we're going through these various elements of newsworthiness, if anyone wants to maybe after during our Q&A session, if they want to bring perhaps some examples that they've had of some of these elements that they've used, or perhaps you're interested or have some thoughts about using. Just keep in mind that we reviewed Injustice, Seasonal Link, Research / Breakthrough, and now we'll talk about conflict and controversy, which is another sort of natural element of newsworthiness. Just a note of caution that just inherently conflict and controversy can be intimidating to some, because obviously you don't want to involve your department in any conflict or controversy, and you want to be able to control the message and the coverage. So it takes some foresight and understanding the issue that you're dealing with. So the example that we have here is a story that was reported about in Arizona about the number of Arizona children claiming vaccination exemptions. And this was, and as we'll see throughout all of these examples, many of these stories have a number of elements of newsworthiness. And when you have the more elements of newsworthiness in your story that you can sort of rack up, the more attractive it'll be to journalists and editors as a potential news story. So again, here we have, the element of conflict of controversy, given that there was a lot of inflammatory misinformation spread on social media and other media, and continues to be spread about vaccination. So public health officials in Arizona were reaching out to schools and doctors to provide evidence-based information about vaccination. So we had not only the conflict and controversy about the misinformation, but we also had some trending information that showed that vaccination exemptions were rising. So that was a troubling trend. The next element is local angle. So two things about local angle. One is your local angle is important if you're appealing to local press. So in other words, if you're pitching a story to the Merced Sun-Star, your story shouldn't be about another community. It shouldn't be necessarily about Fresno or Visalia. And if it's a story that's kind of a statewide focus, you're going to want to somehow include that local angle so that local media will be interested in your story. So that's one sort of explanation of a local angle. Another explanation, which is even more effective in terms of gaining media attention, is what we call localizing a story that perhaps is a national story, a national trend. Maybe it's an episodic story that's going on nationally, whether it's an event like a shooting or something else that has gained national attention, and you're able to find that local angle. Maybe a local group is doing something about that national event or national trend or whatever it is that we're seeing. Or maybe there's a local example of, again, a national story. So it's this idea of localizing something for your local news media that reporters and editors are always hungry for. Our next element is irony, and the example that we gave is from the Central Valley, which, as we all know, is known as the nation's fruit basket, and yet isn't it ironic that we have a number of low-income residents in the Valley who have little access to fresh food. So that was an ironic element that Grist, which is an online publication, used to report a story of the food deserts in California's Central Valley. Obviously, your news element, or rather a news story, has to have a broad enough interest. And usually any story that you're thinking about, if it's around public health or social determinant of health or a social issue, inherently it's going to have a broad interest. But it's just something to keep in mind that the broader the interest, the more people that may be either impacted by this issue or are interested in this issue, the better that story will be picked up. So for this example, we used, again, a report. So there's that other element of newsworthy of research/breakthrough that showed nearly half of adults in Fresno County had either pre-diabetes or undiagnosed diabetes. The next element is Anniversary Action Day, and this is very similar to seasonal link, so it's really keeping track of the calendar. We're going to talk in a bit about how to keep an editorial calendar, but this is something that we can anticipate we can prepare for, we can mobilize speakers, perhaps visuals, perhaps other story elements that we'll mention in a second, excuse me, to prepare for some sort of news story pitch or coverage around an anniversary action day. So as many of you may know, this year marked the 50th anniversary of the Kerner Commission report, which was a groundbreaking report commissioned during the civil rights era that showed just how deep our national sort of racial divisions were, and made a number of recommendations to address this problem, including diversifying newsrooms throughout the country. And unfortunately, that's a goal that we've fallen far short of. And it's important to keep in mind because actually the news media itself can be a social determinant of health based on whether the media is exacerbating social problems by inaccurately or using stereotypes or providing misinformation about certain groups. And so we have to be strategic when we're thinking about engaging the news media and whether our local news media market is primed for building those relationships. So I'll talk a little bit more about that in a second. And then last is celebrity as an element of newsworthy. Having a celebrity tied to an event or some sort of a press event or a program or whatever is almost certain to gain media attention. A word of caution, though, that having a celebrity, you can't always control their behavior. So you may have a celebrity attending some sort of function that you and your partners have put together, and if the celebrity got a DUI the night before your event, guess what the news is going to be about? Not your event, obviously. So, but here we have a really great example of a celebrity that was used in a very helpful way. We had Warrior star Stephen Curry visited Martin Luther Elementary in Oakland to talk about the importance of drinking water instead of sugary drinks. And then the event culminated in the kids getting to pour cups of water over Stephen Curry's head. So gained a lot of media attention, and again brought attention to the importance of reducing sugary drink intake.
And I'll just add to that, it also gave an opportunity for one more thing that's helpful in attracting attention to get news stories out there is a great visual, as you can see with the photo. And that's something that health departments can bring to a lot of these movements is different visuals, whether it's the connections you have with people on the ground doing the work or data. You know, we do see a lot of maps and different data points in the news, and so we want to be careful with how much data we use, but it can be a visual or a new report cover or different things like that. You know, medical doctors being able to stand in a white coat with a stethoscope is always visual as well.
So some questions to sort of consider really quickly as we think about gaining media attention and building relationships with reporters is that we can be either proactive or reactive, and we'll talk a little bit about both. But in terms of proactive news coverage, some questions you want to keep in mind is what obviously can you do to create news coverage, and this might be led by one of your community partners as opposed to a health department, but you still want to be strategic and come to a consensus about what it is that you want to do to create and to gain news attention. Obviously, you want to think about who the sources are going to be. We'll talk a little bit about the importance of authentic voices, but sources are very important to have lined up, and having a diversity of voices is important. Obviously, preparing spokespeople, people who will provide their own personal stories, and others, it's important for them to be prepared so that they leave with a statement about what we what we're advocating for a solution to the problem that we're highlighting.
And this, I would just add, is a great place to connect to colleagues if you weren't able to attend the in-person training or to regroup around those materials. So when Fernando's talking about what reporters might ask and to whom, the message development strategies we use there and that Heather posted the link to are great worksheets to go through in the health department and with your partners to make sure people are on message and are prepared to get the solution in there. And we talked about the idea of a portrait story, which is very narrow, and a landscape story, which allows people to start to think about what are the systems that create health inequities and to get a little bit of that landscape in there. So when you practice your message and practice having that landscape in there, you're much more likely to be able to get that into your press release or the on-the-spot interviews, into your social media. And even if, as a health department, you're facing constraints, we know that sometimes it can be challenging to be able to be proactive because working in government. But health departments are conveners, and they often have the relationships with a lot of different groups, from youth to school groups to parent groups to clients to faith-based. And if you're not able to be the one out front speaking to the media, now we hope you're getting all of these resources from us and getting more comfortable. You could work with a coalition to work through some of these tools. The message development tool is only one side of a page. You can go through it, and then those people will be more prepared to talk about why housing or why the fires or why immigration or why water grabs are a public health issue, and most importantly, get some of the values in there and get to the solution, since we often spend much more time on the problem and neglect the solution. So those are how what we're talking about today fits with what we talked about before. And then I just wanted to mention, again, tied into that, is the idea of authentic voices and messengers. Journalists and reporters are always looking for people who can speak about these issues and are authentic, not just a talking head, but can really speak about this. And so, there's a wealth of folks in San Joaquin Valley, from community activists. Youth Leadership Institute was at the training. They have offices in Merced and Fresno and work with youth. There's community organizations, faith leaders, researchers. In some of our news analysis in the Central Valley, we saw a lot of community colleges and colleges. The Office of Diversity and Inclusion had some of the most mentions in the newspaper around racial justice or social justice. And so there's a lot of different opportunities to think about which authentic voices can be there and how the health department might prep them, and also how health department folks might be authentic voices too. So again, in the example around housing in Alameda County, staff were able to have their stories in our report on housing and how it was affecting clients, and those stories became authentic voices from the health department that were prepped ahead of time, so that we could really control how the stories and the messages went out.
So here's a list of just some tools to keep in mind to generate news. We're going to go through 3 or 4 of them. So again, as Kathy just mentioned, it's really important to keep in mind our community members and partners that we work with, so that you can work in a coordinated fashion if you've decided that you want to gain media attention around a specific issue. It's important to monitor the media. We're going to talk a little bit more about that as part of building relationships with reporters and generating news. There's different ways to create news. We can probably come up with an entire separate webinar on different ways to create news. there is a paid advertising as a strategy for creating news and gaining media attention, but as we all know, that's prohibitive in terms of cost for many health departments. But we offer it as an option because some advocate groups have used paid advertising effectively. There's piggybacking on breaking news, which I'll talk about in a second. Editorial strategies such as editorials, opinion editorials, letters to the editor, and again, we'll also mention a couple of examples there. We're going to talk a little bit about editorial calendars as a tool to generate news, and then, of course, social media is a great way to not only help you generate and gain media attention, but more importantly, a great way to build relationships with journalists, which we'll also talk about in a second.
And I'll just note, when we did the in-person training, we got a lot of feedback on the evaluations that people have a lot of questions about social media. It's a lot of content, so it wouldn't quite fit in today, but we want to think about also hosting another webinar just on social media since so many people asked about it.
So I'm going to give a very quick example of piggybacking on breaking news from my own experience as a journalist and editor. So I was at the Orlando Sentinel in Florida in 2009 during the great swine flu outbreak of 2009. And my charge was, at the time I was actually a medical science writer, and I was asked to essentially write a swine flu story every day. After about the second week into it, I ran out of story ideas. I had written about swine flu trends in terms of where the hot spots were. I had written about, of course, being in Orlando, I wrote about some cases that popped up in Disney and how there was some questions about quarantine and so there were lots of stories in the beginning, but again, after about the second week, I sort of ran out of ideas. Fortunately, around the same time, there was a group of advocates in Florida that were pushing for sick day benefits for full-time workers in the state. And they had noticed that in all of my articles about the swine flu, that I had an information box at the end of the article that gave advice or suggestions to avoid the swine flu, including staying home from work. And so there was this group of advocates that used that to piggyback on to present or pitch, rather, their issue that they were pushing for, which, again, was sick day benefits. That was a perfect example of how I was looking for stories to continue the swine flu coverage. This came at a perfect opportunity and, in fact, gained front page coverage for several days after my initial story that, again, was introduced to me by advocates. So that's an example of how you can piggyback on breaking news or even episodic news and give your own sort of spin and tie it to that issue or event. Letters to the editor can also be very effective. Some things to keep in mind is to make sure to follow the news that your target follows, and your target, again, would be the decision maker or the person who has the power to make the change that you're seeking. Just like the swine flu example, you can piggyback on related coverage with a letter to the editor. Make sure to keep in mind that you have to be timely, especially today now with this 24/7 news cycle. It's very important to be ready to respond. You're going to want to use strong, succinct language that you may not be used to using or writing in your role in public health, but this is something where you can be a little bit more personal. Make sure to keep it short and engage your partners who can either follow up with their own letters or response to your letter to the editor, or maybe get involved in chats or the comment section of the newspaper where they can sort of draw attention again to your letter.
And just to add to that, this is a great way to practice. So if you're struggling with messaging around an issue, you know, it takes time to develop good messages around health equity. So whether it's housing or immigration or, you know, all of the many things you're working on, being able to fit it into 150 to 250 words really is helpful. And you can host, you know, letter writing parties where people read each other's letters using the message components in the worksheet, and people get to start to be able to tell what works and what doesn't. You can also be prepared and have the basics of a letter and then piggyback when something comes up. And we also just want to mention that it's good to be clear on whether you're writing this as a staff member, which is going to take, I'm sure with all the health departments on here, approval from those higher up than you or following your health department or county policy versus a resident. And even as a resident, you know, you may want to just make sure that you are thinking about how you know, having a conversation and making sure that you are clear on what you can do as a resident and what you can do as a staff member. Heather just posted some general letter to the editor tips, and we also have one of the things we're really interested in doing at the MSG is changing the narratives around taxes and government. And so we have letter to the editor tips just focused on that, and we did a campaign this year with Public Health Awakened, which is another public health group run out of Human Impact Partners. And so this is our director, Lori Dorfman's letter that got published in the Sacramento Bee. She was really focused on taxes. They actually edited some of that out. But here's an example of tying in many social determinants, taxes, racial justice, cannabis, and police violence, and and neighborhood disinvestment. And so she piggybacked on an op-ed that someone wrote and to really emphasize that tax message as well. And so this is just showing that because we were ready and had the prepared when this came up, she was ready to move quickly.
So I've already mentioned a couple of newsworthiness elements that would be helpful to have an editorial calendar for. We talked about seasonal links, holidays and anniversaries. So having an editorial calendar of these major holidays and commemorative days and seasonal events can be really helpful to be able to plan ahead. So we have another link, as you'll see on our site chat box, for a great editorial calendar tool that we found that could be really useful to a lot of you. So before we go to our last sort of question and answer slide, I want to briefly go over some key tips, insights for building relationships with journalists. So the first one is to identify reporters to contact or connect with and monitor their work regularly. So there are a lot of media options that there may be in your community. It may be, you know, all the traditional media in the larger markets such as Fresno, Bakersfield, Sacramento areas where you'll have, you know, a good, robust TV, radio, and press market. In some of the smaller markets, you may be looking at weekly publications, or we may be looking at blogs or other sort of podcasts, other ways that people get information out. But it's really good to do a scan, basically, of your media market and then start building a contact list by looking at stories that are done well, that include the public health perspective, that maybe include structural, systemic issues around a particular subject that the reporter's writing about. That may include some solutions. So if you can start building a database or even just a Word doc list of journalists, bloggers, and others that seem to get it, that seem to be sympathetic and understand the frame and message that you're working towards. It's very important to start keeping track of those names as well as those media outlets. It's a good idea to contact journalists directly, and especially when they do a good job. Like anyone else, reporters respond to positive reinforcement. And the reporting profession can be very, very brutal in terms of messages from disgruntled readers or viewers or listeners. And of course, with the advent of social media, there can also be a lot of dissent and disagreement with stories, whether it's our top administration talking about fake news to a local reader or listener that is criticizing a reporter for an angle they took or what have you. So reaching out to a journalist and then telling them that they did a good job can really go a long way to build relationships with. It's also it's very useful to become a trusted, valued source for journalists by providing them with resources. It might be some statistics or, again, some trend information. It may be some relationships that you've built with advocates or other community members that can tell their story in a compelling way, that can maybe provide visuals, as Kathy pointed out earlier. There's many ways that you can become a valued source for journalists, and being upfront, proactive, and consistent can really go a long way in that regard. And then last, if you're working on an issue that is a sensitive issue, maybe, for example, suicide prevention or sexual violence prevention, these are topics that if we have a source that maybe experienced firsthand one of these sensitive topics or issues, we're going to want to obviously be protective of that source so that the interview process doesn't become re-traumatizing. So there are some really great tips and pointers that we don't have right offhand, but I can get for you if you're dealing specifically with, as I said, survivors of trauma, to help establish some boundaries at the beginning, and obviously, we want to be protective of the sources that we work with day to day in public health. So those are the main, again, tips that we'll share with you now.
And I would just add that you can follow reporters and journalists on social media. A lot are on Twitter. It's just a good way to keep track, and that you can, whether it's from your personal Twitter or a health department Twitter, and then you can also put Google alerts on your health department or words like health equity in your area to monitor, or specific issues you're working on to monitor the news. So with that, we wanted to open it up for question and answer. While folks are typing, we'd love to hear concrete things that you're working on that maybe you are wondering how to make newsworthy, or your own great examples of stuff you've done. I will just note that we'll be sending out a follow-up email that has a lot of the links that have been in the chat box, and an evaluation. We'd love to hear from you and what you would like more of from us. And then once it's out, it'll take a little while, but there'll be a recording of this webinar, and we will send that out to everyone who signed up for the webinar, whether you were able to participate or not today. So any questions? We don't have any so far. You have Fernando here, a journalist. Yes, we will send the PowerPoint slides as well. So if you want, you know, the real-life perspective of a journalist, you have Fernando here. You could ask his opinion on an idea you're thinking about for a news story.
Or if you have a public health dimension to your question, and Kathy can also address that as well. I do want to say that Kathy had mentioned that many of you, and she also mentioned it at the outset, that many of you are working on fire-related stories. And so there are some opportunities there to think strategically long-term about how you can either go back to a journalist or blogger or somebody that's contacted you about a fire-related story and continue the conversation to maybe steer some coverage around whether it's air quality, whether it's housing, climate change, or backpedaling climate change to talk about it in a way that's more appealing to maybe more conservative audiences.
So we do have a question. This is a great question. How do we even begin to reach out to a reporter? We're a very small county with very small news outlets for different towns within our county. So what are some of the very first beginning steps?
Sure. So as I said, some counties are going to have a lot more media that serves that particular area, and some counties are more rural and therefore have less sort of resources in terms of media. But remember that first of all, your larger media can still serve the smaller communities that are in its coverage area. So you may be, you know, in a small community, maybe, one of the foothill communities, for example, but you're still going to have your larger market that will be interested in writing about a particular issue. Again, if you can link your story to one or more newsworthy elements, the more newsworthy elements that you can sort of pitch your story around, the more likely it is to gain coverage. And also think outside of the box in terms of media outlets. Think about, you know, podcasters, think about bloggers, think about, perhaps somebody who uses social media a lot in your community that gains, that reaches a lot of people. There's ethnic press. Radio is huge in the Central Valley, and a lot of people forget that radio also provides a lot, or is hungry for content when they need to provide some local either news reports or any other content.
And from sort of a more internal angle at a health department, how I would go about it would be first just tracking. So, you know, following reporters on Twitter, making sure I read the news every day, and seeing, you know, who's reporting on the issues I care about. Somebody mentioned a water grab, somebody mentioned immigration, so who's reporting on that? How is their coverage? You know, are they showing any of the landscape? Do they have a health angle? Do they seem like they would be someone good to talk to? That's all things you could put in your notes. What's their Twitter handle? Podcasters, radio folks, social media. So just organizing that in some sort of internal spreadsheet. And then also going about internally and knowing what your system is for reaching out to reporters, whether you need to go through your PIO, whether your health officer might have the ability to do that, whether you need to get approval. And then once you have your overall strategy and you're thinking about whether media would be good or not, and you feel like you've had the capacity to sort of prep in case you do respond and they actually want to interview you and do a story, you've gone through your message development worksheet, all of that stuff, then you can use press releases, more traditional things. You can tag them in a Twitter post saying, wow, we have this new report out from the health department on housing and health. So-and-so's done great reporting on it, wanted to let you know. You can see what events they're going to be at. You can, if you're, maybe it's your coalition partners who are more able to raise the visibility of your report and tie it to a specific policy. But some of the first internal steps would really just be tracking, getting clear on your overall strategy, and then thinking about how to use those elements of newsworthiness to either create news or piggyback on news, or like Fernando said, just say, hey, that was a great story. We're really glad you're reporting on the health link that these fires are causing or how it's going to impact the housing, and just sort of develop it that way. And then just know if they say, hey, oh, you're from the health department, we'd love to talk, anything you say can be on record, so you want to be prepared. Even if folks say, well, it's just getting background, you want to be prepared and go through your county policy because you just want to assume everything's on record. So we have a couple more questions. I know we're over time, but maybe we can take a few more minutes. Are you okay with that?
I am.
If folks are online okay with that?
Yeah.
So here, having a PAR course built on the perimeter of New Health and Human Services campus, received a grant. We'll have to make the community aware about a year from now. Any thoughts? If you monitor the news that are important to your group, you can harvest the bylines of those reporters and reach out to them specifically. Great tip from Heather. What angle would you take for getting a news article about public health presentation that will be happening to the Board of Supervisors? It's meant to educate the community about the local health department and services we provide. So the PAR course being built on the perimeter, so my thoughts as a former health department staff person on that are, if you know that it's going to happen, I would aim for making the community aware earlier on. My experience is when people are brought in later, that's when people can get upset about things. The county I was at used the Government Alliance on Race and Equity's Racial Equity Toolkit. There's great tips and questions in there on bringing in community feedback about how things are designed, using data to make sure we're meeting, we're focused on equity, and thinking about how to just make sure community's involved in any of the ways. So I would think about opportunities to engage community early on, and then a year from now, hopefully you're standing up there with community residents, presenting, whatever design you chose or things like that, or have a broader coalition than just the health department. And I think I'd have to know a little bit more about the details, but other than that, I would say, again, start following reporters now, start thinking of your overall strategy. What are you really trying to achieve? And start thinking about what news outlets might be helpful, and just really going through the layers of strategy. It's a pretty simple document, and it seems like things you could just think about in your head. But really what I've seen is when you get together with folks and start talking about it, it's very robust, and there's a lot of things that come out from the wisdom of the group that you might not have thought about if you're just working with the same one or two people that you work with. And feel free to contact us with more information. The Board of Supervisors presentation, again, it's, I know we keep saying the same things, but I'd go back to the layers of strategy. What are you hoping to achieve? What would you like the community to do with this information? And what would you like the board to do? And then thinking about, there's a question in the overall strategy about allies. So do you have community partners who you're already allied with who might be able to stand up there with you? Or do you have clients who could talk directly about how the services have impacted them, especially if you're thinking about like youth services or things like that? And, just having a more diverse and broad coalition standing up there with you so people start to see maybe your goal is to have people see the health department as a bridge builder or a convener or a connector, and when they see you standing up there with all of these different organizations, that really builds that both for the board and the community. Maybe it's related to accreditation in areas where you need to grow or change, and so you present a lot of the solutions that are working, but say, we're going to have a series of community meetings for our community health assessment, and we want your input, so being ready to go with those. But again, just going through the simple tools of the layers of strategy will help you solidify what your goal is, and then that will help you think about how to get the news article, whether it is just sending info out to the reporters you've built relationships with, maybe doing something more newsworthy, like out front of the board meeting. I keep going back to young people, but working with youth is a great way to get news, so maybe there's some visuals about the services, doing an asthma test in front of the board meeting, or whatever it is you're talking about that would give reporters visuals. And just going through and thinking about, are there elements of newsworthiness that you could work into whatever you're doing in a press release or alerting reporters on Twitter? Is there an injustice? Is there a new report? Is there, anything, an anniversary, anything else going on? Fernando, I don't know if you have any thoughts. No. So I know we're over time, but we're available and, happy to talk more. We're really passionate about health departments and health equity and communication, and through the California Endowment Grant, want to be a resource to you. So looking forward to talking more today. We'll be sending out lots of info, and also look forward to hearing from you in the evaluation.
Just echo Heather's message to all participants. Thank you so much for your participation today, and we're looking forward to continuing our conversation.
Thank you.